Welcome to the recorded version of Caring for Someone with Alzheimer's, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from HOGAN Senior Care.
All right, our presenter today is going to be LAKELYN HOGAN. LAKELYN is the caregiver advocate for HOGAN Senior Care. She holds a graduate certificate in gerontology and is currently working toward a Master of Arts in Social Gerontology. She also holds a Master's in Business Administration, and her undergraduate education focused on marketing and communication studies. LAKELYN has professional experience in the private and public sectors of senior care services. She has worked on special projects for the University of Nebraska Omaha's Department of Gerontology and the local area agency on aging. She is also active in her local chapter of the Alzheimer's Association. LAKELYN has experience assisting senior clients and helping their families navigate the senior care continuum. So she is passionate about helping others, especially aging adults and their families. And with that, I would like to welcome our presenter for today, LAKELYN HOGAN. Thank you again for being here today, LAKELYN.
Thanks so much, Steve. And thanks to all of you who have tuned in today for the webinar. We're going to talk about a subject that I'm very passionate about, and that is caring for someone with Alzheimer's disease. While Alzheimer's and other dementias is not a normal part of aging, we're seeing more and more seniors affected by this horrible disease. Along with the growing number of seniors with dementia, we're also seeing more families stepping in to provide care. And I've definitely witnessed this firsthand, and caring for someone with Alzheimer's is no easy task. So to get us started, we're going to look at our objectives for the webinar here on the next slide. Again, I'm so glad you joined us. Being a caregiver is no easy task, and oftentimes they look to us as professionals for support when caring for their loved one with this disease. So today I'm going to go over some information that I hope you'll find helpful when working with those family caregivers. I know you're probably all familiar with the disease, but I'm going to start out by reviewing some of the basics so that we're all on the same page. Then I'll go into more detail about the symptoms and how to minimize them. And symptoms are what can make this disease difficult to cope with. And we can help families determine the cause of these symptoms and learn different strategies. And then it's also important to help family caregivers realize the importance of taking care of themselves as well. So I will wrap up with some tips and some resources for the family caregiver. But before we jump into the basics of dementia, I have two quick polls. So they're going to show up on your screen. The first is I want to get a feel for who we have on the call. So you'll choose the answer that best describes you. You'll just go ahead and click it there. So if you best identify as a social worker or discharge planner, click that option. A nurse, other healthcare professional, family caregiver, or if none of those work for you, you can click other. So go ahead and choose the one that best describes you, and then we'll have the results pulled up here in just a moment. A little audience participation. All right. Awesome. Okay, so we have lots of social workers and discharge planners, a good portion of other healthcare professionals, some family caregivers. Wonderful. And then I just had one more quick question to get us started. You also want to choose the statement that best describes you. So I'd like to know if you have cared for someone personally, maybe it's a family member, friend, with Alzheimer's or dementia, or you've cared for someone professionally with Alzheimer's or dementia. So maybe you work at a community setting, a hospital, and you've had professional experience. Maybe you've done both, so you can select both A and B. Or if you've never cared for someone professionally or personally, you can click none of the above. So go ahead and select the answer that best fits you. Sorry, that second option didn't quite all fit on the screen, but it does say professionally work with Alzheimer's or other types of dementia. All right. So lots of professionals on the line here, and then quite a few people who have done both. So that's good to know. So some of this might be a refresher for you or might help you better serve those that you work with professionally with the disease. All right. So again, just to make sure we're all on the same page, I'm going to go over the basics of dementia on the next slide. Dementia is an overarching term. Simply defined, it is a decline in mental ability severe enough to interfere with daily life. And I like to think of dementia as an umbrella. It's more of an overarching term, and there are a lot of different kinds of dementia that would fit under that umbrella. You can see that graphic there on the slide. So vascular dementia, Lewy body, frontal temporal. The most commonly known is Alzheimer's disease. And some individuals might have a mix of a few of these different types. And you may hear dementia used interchangeably with these different types of dementia. But it's important to keep in mind that if you are talking with someone and they say, oh, my mom or dad has a dementia diagnosis, if we can identify what type of dementia, that'll be important to how we can better help them, because there are different techniques, different aspects of each type of dementia that can really affect the way that we provide care. But throughout today's presentation, since Alzheimer's is the most common, we're going to focus more specifically on that type of dementia. So let's take a look here on the next slide at Alzheimer's disease. And again, I mentioned it's the most common, and in fact, it's the #1 cause of dementia according to the Alzheimer's Association. The reason that Alzheimer's disease is so devastating is that it leads to nerve cell death and tissue loss throughout the brain. And over time, the brain shrinks dramatically, affecting nearly all of the brain's functions. And currently, there's no cure for Alzheimer's. There are many clinical trials, many drugs out there that can minimize the symptoms, but none at this time can cure or reverse Alzheimer's disease. So you can see why someone with this disease would need the help of a family caregiver. As the disease progresses and they start to lose their abilities to function independently, they're going to lean on those family caregivers. So while on the topic of family caregivers, I have another quick poll. In 2015, approximately how many caregivers provided care to someone with Alzheimer's disease? So again, in 2015, approximately how many caregivers provided care to someone with Alzheimer's disease? Is it 750,000, 1 million, 9.5 million, or 15 million? So use your best educated guess. They're all big numbers. This disease affects a lot of people. So go ahead and select your answer, and then we'll see what everyone thinks. All right. 9.5 million was the guess. It's actually 15 million. That is a lot of people. 15 million family caregivers provided care to someone last year with Alzheimer's disease. So let's look at a few more statistics on the next slide. I think it's good to put a little context around the discussion by diving into some of these statistics. You may have heard these numbers before, but I share them with you to reiterate the prevalence of this disease. So in the U.S., the Alzheimer's Association reports that in 2015, more than 5 million Americans had Alzheimer's or another type of dementia. And every 66 seconds, so a little over every minute, someone develops Alzheimer's in the U.S. And it's currently the 6th leading cause of death, with 1 in 3 seniors dying with Alzheimer's or another dementia. And sometimes this number can be skewed because upon death, the Alzheimer's disease might not be listed as the cause of death. Interestingly enough, actor Gene Wilder, he just passed away. He played Willy Wonka. They did note that he died of complication of Alzheimer's disease. I thought that was pretty interesting. So again, it's still very prevalent in the reasons why people die, but sometimes the physician at time of death would write down pneumonia and not pneumonia due to complications of Alzheimer's disease. I hope that makes sense. So anyway, we're still trying to drill down even further to make sure that these numbers are really accurate, but according to the Alzheimer's Association, they have that 1 in 3 statistic. And this is an expensive disease. 1.1 billion hours of paid care by a family caregiver took place in 2015, which equals over $220 billion. That is a lot of money. And that's not even the paid care that's out there. I also wanted to highlight a few statistics in Canada, and this is according to the Alzheimer's Society Canada. 564,000 people are living with dementia, and Alzheimer's costs Canada an estimated $10 billion per year in terms of the healthcare system and out-of-pocket caregiver expenses. And then if we look at it from a worldwide perspective, it's not just a problem here in North America. There are more than 46.8 million people living with dementia worldwide. So again, this is almost an epidemic, some call it, that's sweeping the world and our nation. So on the next slide, we're going to look at some more statistics geared towards the family caregiver. Having dementia involves memory loss, loss of cognition, judgment, and the ability to take care of oneself. So caring for someone with Alzheimer's can be more demanding and more stressful than caring for someone who is ill but not cognitively impaired. And according to the Alzheimer's Association's Facts and Figures report last year, 59% of family caregivers gave their emotional stress a rating of high or very high. In addition, 40% of family caregivers report symptoms of depression, and this is compared to 5 to 17% of non-family caregivers. I want to just stop here because that's a pretty significant number. The rate of depression in those caregivers that are caring for someone with Alzheimer's is more than double than those of non-caregivers. So we need to keep that in mind when working with these family caregivers. Not an easy job. And these caregivers are devoting a lot of time each week to the tasks of caregiving. In addition, they may have kids of their own. We call these individuals the sandwich generation. They're caring for their aging parents and raising their own children. And this can be further complicated if the caregiver is working outside of the home. So I have one last quiz question that is related to caregivers that work outside the home. And the question is, how many family caregivers had to go in late, leave early, or take time off of work to care for their loved one with Alzheimer's? So these people are having to make workplace adjustments in order to provide care. So the options are 17%, 32%, 54%, or 61%. So go ahead and take a guess at what you think might be the answer. All right. It's actually 54%. So the people that chose 61, you were close. But 54% is still over half of individuals that are working, that are having to make those workplace adjustments in order to care for an aging loved one. So that's pretty significant. And along with the stress of caring for an aging loved one, balancing family, work, personal life, there's a real problem with isolation. So we're going to look at that a little closer on the next slide. According to a survey through the Home Instead Network, 74% of caregivers report they have become isolated in caring for a loved one with Alzheimer's. The majority of those surveyed say it's difficult and can be overwhelming to provide care. They report that they leave the house less frequently with their loved ones, they feel a reduced quality of life, and they simply stay home because it's easier due to the unpredictability of symptoms of Alzheimer's disease. And hopefully after today, you can help these family caregivers overcome their isolation, or at the very least help them feel less isolated in providing care, and help them manage those unpredictable symptoms. So we're going to do a quick refresher here on the next slide of those symptoms. According to the Alzheimer's Association, these are the most common symptoms of Alzheimer's disease. So I wanted to go through them quickly and provide a couple of examples. The first is memory loss that disrupts daily life. In this case, you might see a little reminder notes around the house, sticky notes, because their memory just isn't as good as it used to be. They might also have difficulty completing familiar tasks, challenges with planning and problem solving, confusion with time and place. They may forget where they are or how they got there, trouble understanding visual and spatial relationships, misplacing things and losing the ability to retrace their steps, decreased poor judgment, a withdrawal from work or social activities. You know, they might quit going to a Bible study or a bridge club so they won't notice the changes, or the other people around them won't notice the changes in their memory. They might also withdraw because they're embarrassed of their memory loss. A few more would be changes in mood or personality, or problems with speaking and writing. So as professionals, we can provide families with this information and help them decide if they should be concerned about it and bring it up to the physician. If a family member is noticing several of these symptoms, it could indicate that the individual is in the early stages of Alzheimer's and they should contact their doctor for a screening. It's important to note that these symptoms of Alzheimer's usually develop over a period of time. So if you're working with a senior who, out of the blue, starts having these types of symptoms, contact the physician right away because it could be due to something other than Alzheimer's, such as a urinary tract infection or UTI. So as the disease progresses, there's likely to be more symptoms that surface, and they generally fall into two categories. So let's take a look at those categories on the next slide. Helping families understand these types of symptoms will be important when providing care. And I wanted to point out that I'm using the word symptoms and not behaviors. These terms are used pretty interchangeably in the industry. I prefer the word symptoms because we're talking about a disease that has taken over the brain. When the term behavior is used, it can sometimes convey that a person is acting out on purpose, when in fact, the person with Alzheimer's has no control over what the disease is doing to their brain. So I wanted to do a quick little exercise with you, and I do this when I'm training our home and sed caregivers on caring for someone with Alzheimer's. So this quick exercise, I have them write down 3 things that are important to them. So you can go ahead and do that if you have a piece of scratch paper in front of you. It can be tangible or intangible. So 3 things that are really important to you that you couldn't live without. Okay, so hopefully you've had time to do that. Now, cross out the middle one. So if you wrote them kind of in a list, cross out the one in the middle, and then cross out the first one that you wrote down and circle the last one. Now imagine that you have Alzheimer's and the memory of those first 2 things that were really important to you were taken away, and you can only remember the last one. For me, I listed faith, family, and friends. So the last one remaining is friends. So in this case, I might be able to remember my friends' faces and names, but not my family members. And I can only imagine how difficult it would be for my family to accept this. This disease does not allow the person to choose what we can and can't remember, and therefore it doesn't allow them to choose their cognitive or behavioral symptoms. And most of the time, the person is exhibiting these symptoms because they're trying to tell us something. So when you're talking to family caregivers, this might be a helpful way of explaining to them how the memory loss occurs and why. So again, when we're talking about symptoms, it might be helpful to think of them in 2 categories, memory and behavior. So you can see on the slide there are a few examples of each. Under cognitive, we have confusion, judgment, repetition. Under behavioral, we have aggression, anxiety, agitation, and mood changes. So we have to start explaining these symptoms in a new way to ensure that we're focused on the person's needs, as well as confirm that the disease is persistent and causing the brain to fail. So when we talk with families about these symptoms of Alzheimer's, we need to recognize that some behavioral symptoms may put the safety of the individual at risk, while some of the other types of symptoms can be frustrating and difficult for the family caregiver. And sometimes it's hard to know the difference. So I have this helpful chart on the next slide that will put some perspective to the whole discussion. I really like this chart because it ranks these symptoms in terms of frustration, difficulty, and danger. It gives perspective. When a family member is diagnosed with Alzheimer's, it's most likely that the family will fear the type of symptoms that their loved one might exhibit. So if we can break it down into these kind of categories or along this spectrum, it can help families better cope and anticipate potential symptoms. And some of these symptoms can be frustrating to deal with, such as repetition. When someone's repeating the same question over and over, it's not necessarily harming the person with Alzheimer's disease, but it may be driving the family caregiver nuts. Just to give you an example, I had a client who would always ask about the next meal. When is lunch? Over and over and over. And the caregiver was getting so frustrated. And to cope with the frustration, I helped the caregiver brainstorm several responses to the question. So I encouraged her to try a few different things, such as, well, it's not quite lunchtime, but how about we grab a snack? Or, I'll make lunch as soon, but we have to get you cleaned up first before we eat, so let's go take a shower. Or, speaking of lunch, what was your favorite thing that your mom made you for lunch as a kid? So if we are able to redirect to another topic or an activity, it can help to manage that specific symptom. Other symptoms can be harmful, like wandering, which of course needs immediate action. And actually in November, I'm going to be doing an entire webinar on wandering and Alzheimer's disease, so be sure to tune in to get some helpful tips on that. But back to the chart, it can be helpful when talking with family caregivers about the symptoms and determining what kind of action will be required. And I've mentioned earlier that a lot of times these symptoms arise when a person with Alzheimer's has an unmet need and they're trying to tell us something. So we need to help our family caregivers tune into those needs. So let's take a closer look on the next slide at what those needs could be. And because language is often affected by dementia, people with the disease may tell you about their needs by showing you. By acting a certain way, they may be trying to communicate what they want or need. And if the family caregiver is able to tune into these 4 different categories that you see on the slide, the caregiver can better understand and manage the unmet need. It's helpful, I think, to group these needs into these 4 categories. So emotional needs, social needs, physical needs, and environmental needs. And I wanted to give you a few examples. So if a person is pacing back and forth in a room, they might be trying to find the restroom, but they're unable to express it. So they have a physical need that needs to be met. Or if the individual is out in public and won't get up out of the chair, or they're getting really agitated, it may be due to the fact that there's too many people around. It's too noisy. So that's an environmental need. So you can see that this chart can be important in understanding and recognizing the unmet need. And when it's understood, it can lead to more confident care and good days. So once the caregiver knows why a symptom is occurring, then what do we do? Well, we'll take a look at some tips here on the next slide. So the answer is all in the approach, and that is the relationship or person-centered care. And most of you probably are aware of person-centered care. It's a hot topic right now, and hopefully you're using this type of concept in your settings. The idea behind person-centered care is personalizing the care to the individual. We need to encourage families to use personal life stories, the individual's likes and dislikes, their hobbies, their favorite pastimes, to help minimize the symptoms and provide meaningful activities for their loved one. They can work this personalized care into their loved one's routine and better engage them in a meaningful way. Most of the time, the caregivers don't know that their loved one, they usually know their loved one better than anyone else does, and therefore they will know the best way to personalize the care. Sometimes they just need examples and encouragement, and as professionals, we can provide that to them with different tools and encouragement. So just to give you some examples, if a person with Alzheimer's disease is exhibiting an emotional need, say that they're sad, we know that this might be an unmet need, and if we don't redirect the sadness, the person might escalate to crying or becoming physically distraught or angry. So if the family caregiver knows the person's favorite pet or a favorite pastime or hobby, or maybe even a favorite food, they can redirect that sadness, such as maybe they know their favorite flavor of ice cream. They could suggest going to get ice cream. Or if they know the first person's favorite pet, they could bring that pet up in conversation, get them focused on something happy, a thought that really engages them. So as we transition to the next slide, I want to give some real stories that include examples of behavioral symptoms. In each of these examples, we'll understand the unmet need or needs. We'll look for ways to help the family approach care and then learn conversation starters and prevention tips. And I want you to be able to use these stories when working with families. I know many of you probably have your own stories, but having examples in your back pocket can help illustrate your points as you visit with these families. Okay, so the first situation. This family caregiver's name is Liza, and she was seeing behavioral symptoms in her dad during personal care. And personal care is bathing, grooming, restroom assistance, those types of things. She said, Dad really becomes aggressive when you push him to do something he doesn't want to do, mainly with personal hygiene things. Last year, it got to be more and more difficult to change his clothing or to get him to shave or bathe. So, in this situation, let's look at some of the unmet needs. In addition to the next slide, let's try to figure out why this is happening. So if we go through each of the categories of unmet needs, in terms of physical, is he in pain? Is he tired when these types of activities are taking place? Maybe there's some emotional unmet needs. Maybe there's a fear. Maybe he's insecure. Maybe he's feeling a lack of control. He's losing his abilities to do these things for himself, and it's making him frustrated. In terms of the social unmet needs, maybe it's that his daughter's providing the care, and he feels uncomfortable undressing or bathing with his daughter around. What about the environment? Maybe it's too cold, or maybe he doesn't feel safe. Maybe there's a need for a grab bar, or maybe if the bathroom was warmer, he'd be more likely to engage in those personal cares. So if we can think through those unmet needs, again, it can help the family determine some different care approaches. So let's look at those approaches on the next slide. So in this situation, Liza's family started to use new techniques, such as bed baths or no-rinse bathing wipes and dry shampoos. They would use that on days that he would absolutely refuse to get in the shower. And some days that might be the case. We can always try again the next day. They would also take him for walks, but they would use those walks as an incentive to do something. For instance, they would say, all right, Dad, I know you love going on walks. Let's take one after we get in the shower. And then my favorite technique is she would sing to him as a method of decreasing his combativeness during personal hygiene. Liza would start a song and get him to make eye contact, and by participating in the singing, it allowed him to focus on something else and allowed Liza to still help him with those personal cares. And also, Liza knew her father's likes and dislikes, so she was able to understand his routines and understand his unmet needs and came up with these different solutions to minimize his anger. And just as a side note, I know bathing and personal care is commonly challenging for family caregivers, so I wanted to throw out a few other techniques that I've learned over the years. Setting a regular time for bathing can be very helpful. Routine can be key in caring for someone with Alzheimer's. And also, if you're able to break up the task into manageable steps, that can be really helpful. And also, by explaining the task before starting can also ease any anxiety. So just to give you some examples, you could say, all right, we're going to step into the shower now. All right, let's get your hair wet. Put some soap on your hand. Let's rub that soap in your hair. And sometimes even modeling. So rubbing your own head with your hand might trigger them to do the same. Sometimes if you just tell somebody to go take a shower, that can be a really overwhelming task, especially if you've forgotten how to do it. But if you break it down into more manageable steps, into little chunks, it can be a lot easier for the individual. And if we're able to incorporate them in the routine, have them still at least do one or two parts of the task, such as holding the toothbrush and putting the toothbrush under the water, or getting that shampoo bottle off the shelf, just including them can help them feel like they still have a part of the control of the situation. So sometimes it's hard to even think about ways to start conversations around these care approaches. So I have some conversation starters on the next slide. So if we want to prevent the caregiver themselves from getting frustrated, there are some conversation starters that will soften the conversation. You could say things such as, "I'm here for your dad. We'll get through this together." Or, "This nice hot shower will be over before you know it." Or simply acknowledging the feeling can go a long ways. So you could say, "I'm sorry that I upset you. Let's listen to some of your favorite music and try to take a bath later." So by the caregiver being less frustrated and more calm and cool will help keep the individual calm in a situation where they might otherwise feel a little uncomfortable. So in these difficult situations, it's important to be proactive and to plan ahead. So on the next slide, I have some prevention tips, especially around personal cares. And when you're talking with a family member, if a situation has escalated in the past, you can talk with them about, what could we have done differently in this situation? And a lot of times it will help you develop these proactive approaches to try the next time you go to do these personal care activities. So again, the slide shows some good examples. Always plan ahead and don't overschedule. For instance, if you know that your loved one does not like to get up in the morning, it takes a while, then it might be best to plan doctor's appointments or other activities in the late morning or early afternoon. That way, if you have to do these personal care type activities, making sure that they're showered, making sure that they're dressed and ready for the appointment, you've given yourself enough time in order to get to the appointment in a timely fashion. Also, be sensitive to those person's most alert times of the day. Again, maybe your loved one is tired around 2 or 3 o'clock in the afternoon. Those would be good times to avoid activities or those critical appointments. Also, if you're trying to identify some patterns or some strategies that work for the individual, keeping a journal with key information can be very helpful, especially if there are several family caregivers or even professional caregivers involved. That way, if someone new comes in to provide respite care or to help out, they can refer to this journal with key pieces of information. Maybe in that journal, they write down the individual's likes and dislikes. Or maybe Liza would want to write down, my dad's favorite song is old Western or old country Western music. So then the caretaker would know maybe those songs are good to play when he gets frustrated or agitated. It'll help calm him down, get his mind off of the frustrating situation. And then always look for ways to help maintain control of the individual's life. So again, I mentioned if we're able to incorporate them in the activity, maybe it's dressing, giving them simple choices. Dad, would you like to wear your blue or green shirt today? Allows them to still engage in the activity and make some choices concerning that activity and helps to get the tasks done maybe a little bit quicker. So I have one more example here on the next slide. And as we go through this situation, I want you to think about the unmet needs of this woman in the situation. So there's a family caregiver named Sharon, and she said, "Lately, my mom keeps thinking that someone has stolen her purse. I'll find her rummaging through her closet or her dresser drawers. When I ask her what she's up to, she starts to get upset and accuses me that someone has stole her purse. At times, she accuses me, with Sharon, or her granddaughter. And once she gets on the topic, she won't let it go and gets even more upset." So let's take a look at what some of the unmet needs might be here on the next slide. So if you think through some of these unmet needs, in terms of her emotional unmet needs, maybe she's afraid or anxious. Maybe she's feeling that loss of independence, and it's manifesting in this type of situation. And socially, maybe she doesn't know how to express her feelings. Maybe there's a lot of change happening. It could be due to a move or, again, the loss of her abilities, and she doesn't quite know how to handle them. Or maybe it's something in her environment that's causing anxiety. Maybe it's a person, a place, Maybe there's a new object. Maybe you got a new house plant, and for some reason, because it's placed in that specific corner, it's making her a little more anxious, and that anxiety is coming out in this way. So let's look at some care approaches that we could suggest to the family on the next slide. I really feel for Sharon in this situation because it's not easy to hear someone accuse you of something you didn't do, and our natural tendency is to defend ourselves. But it's really important in our care approach that we do not argue with the individual. And it's helpful to acknowledge their feelings and even step into their reality. So while the purse might be sitting on the kitchen counter and you know that, you might want to step into their reality. Say, Mom, I'm so sorry it's missing. Let's go look for it. Also, make sure that you tell them that they're safe. The individual is feeling unsafe. Just hearing those words and maybe even a friendly touch, maybe if you take their hand and tell them that they're safe, it can really go a long ways. And again, don't take that accusation personally. And then set out to find the item and maybe even redirect to a favorite topic, task, or activity. So you could say, okay, let's go search for it. And then when you get to the living room, you could switch the topic. Oh, look at this photo here. Isn't that the old family farm? And hopefully that would get you onto a new topic, and Mom might forget all about the missing purse. And sometimes it's easier to just apologize and take the blame, saying things like, I'm sorry, Mom, I must have misplaced it. And I know I've kind of gone over some conversation starters, but there's a few more here on the next slide. So again, you could say, Mom, I understand you're frustrated that you can't find your purse. It's upsetting when you think you've lost a treasured possession. Let's go look for it together. So again, you've acknowledged it, you stepped into her reality, and then you are setting some action. Let's go look for it together. Or, Mom, this must be difficult for you. We'll get through this together. We'll find the purse together. Again, acknowledging their feelings, making sure that they're safe, and that we're going to figure this out. And then, I'm sorry, I must have misplaced your purse. Let me show you where I put it. Again, you might not have misplaced the purse at all. The purse might have been in the kitchen the whole time, but by just saying, I'm sorry, I must have misplaced it, you are taking the blame on yourself. You're not embarrassing your mom by saying, Mom, you put it on the kitchen counter when we came back from the grocery store. So, again, just trying to give you some ideas of conversation starters so this situation doesn't escalate and turn into agitation or aggression of any kind. So let's look at some preventative measures that Sharon can use for the future. On the next slide, sorry. So again, keeping a journal of the times of day or the situations that may be causing this paranoia or anxiety can be really helpful. So you might notice during the evening hours that these situations are coming up. These stolen purse accusations are happening, and that could be due to sundowners. A lot of individuals with Alzheimer's disease start to show some behavioral symptoms during those evening hours. You might determine a safe place to store valuables. So if a purse is really going missing, or if your mom is accusing you of taking her purse, if you always store that purse or other valuables in a specific place, then you'll know where to direct her. Oh, let's go look in X spot. We usually put the purse there. And then look for ways to help maintain the loved one's control in different areas of their life. So again, if this symptom is due to them feeling like they're losing control, try to engage them in other activities and give them a little bit of that control. I mentioned earlier, when you're getting dressed, giving them options. Or next time you go to make them lunch, ask them, do you prefer a sandwich or soup? So again, little ways we can help maintain their control, their dignity, make them feel like they're still able to contribute can be helpful. And if nothing else is working, sometimes it's best to consult a physician. If these anxiety, paranoia are turning into repeated aggressive situations, if you're feeling overwhelmed, sometimes it can be helpful to consult a physician, because it might, in some situations, be due to depression of some sort, and that depression could be treated. So now that we've gone over some examples, let's look at support strategies for the family caregiver on the next slide. All right. So I've mentioned several times, but being a family caregiver is an emotional roller coaster. It's a tough job. You might be working with a family caregiver who wants to be a caregiver but won't ask for help. Maybe the caregiver doesn't want to be a caregiver full-time, or maybe you're working with a caregiver who wants to be in total control. And we all know that these approaches don't always work with Alzheimer's. So let's talk through a few ideas or points that you will need as you are consulting with family caregivers. So with Alzheimer's disease, it affects the core mental functions of a person, and providing care will not always be easy. So one of the most crucial things we can help caregivers understand is that they will have to change to be successful in this role. For example, a person with Alzheimer's disease is talking about who is deceased, but they're talking about them as if they're still alive. The role of the caregiver is to validate the feelings rather than bring the person back to reality. So again, we've talked about this already, stepping into the reality of the individual. And by being in their moment, caregivers will have a better opportunity for successful caregiving. And I use this example because it demonstrates that validation. So again, acknowledging their feelings and have the family caregiver start to practice this. It doesn't always come natural, it doesn't always come easy. And sometimes it's hard not to correct them when they're saying something wrong. But if we realize that the brain is failing and that it's causing them to live in more of a reality of the past, it can help the caregiver provide better care. We also have to make sure that the family caregiver knows that caring for someone with Alzheimer's disease is doable. It can be done, and it's done all over the world. The key is finding the right support and finding others that are going through the same situation. There's a great Help for Alzheimer's Facebook page, Remember for Alzheimer's Facebook page that acts as a support group. I follow that page. It's really neat to see different family caregivers giving each other information, advice, encouragement. So that can be very helpful in realizing that caring for someone is doable. And then a one-size-fits-all approach just simply doesn't work. For those that are working with someone with Alzheimer's or has worked with someone with Alzheimer's, what works one day or 1 minute might not work the next minute or the next day. And that's the hard part about being a family caregiver and even being a professional that works with these individuals. Some techniques that work for certain family caregivers might not work for others. So it's good that we as professionals have a lot of information in our back pocket to help these family caregivers. And then we also need to realize, help family caregivers realize that they are doing the best that they can. So we don't want them to get overwhelmed, and we don't want them to feel like they aren't doing enough or they're doing too little. Family caregivers need encouragement, and they need to know that they're doing the best with what they've been given. And if they need additional resources, if they're feeling overwhelmed or feeling like they can't do it all, we as professionals can provide them with additional resources. So on the next slide, I have some tips for the family caregiver. I've learned over the years that education on the disease can help families provide better care. There's plenty of resources out there that provide education. The Alzheimer's Association has a lot of great information. Also, helpforalzheimersfamilies.com has a great free online family training. Again, I'll share all these resources here in just a few minutes. And then also respite. That is huge for the family caregiver, especially those that are the primary caregiver who are carrying around the clock for their loved one. if the individual can find some respite, get away from the caregiving situation, they're more likely to be refreshed, revived, and come back and provide consistent and better care. The last thing I want to see is a family caregiver getting burnt out, and I see that far too frequently. So in terms of respite, you could reach out to a local home care company, a family member, a friend. The local Alzheimer's Association should also have some respite type resources, so you can always reach out to the local. Sometimes counseling can be helpful as well. I know in certain situations it's sometimes just nice to talk to somebody who's not involved in the situation at all. So if it gets to a point where the family caregiver is feeling very overwhelmed, you could always suggest that they go for some sort of counseling or a support group. Support groups, I mentioned earlier, can be so helpful because they can talk to others that are performing the same type of care, share tips, get encouraged that they're not alone in this caregiving that they're providing. Again, the Alzheimer's Association has in-person support groups. There are also online options, online support groups. I'll share again those resources at the end. And then if the family caregiver is able to manage their emotions and manage their stress, that can be helpful in providing the best care that they can. If their emotions get out of control, it can lead to depression, them feeling overwhelmed. So have the caregiver look for options for relieving their stress, and that looks different for everyone. Maybe it's going for regular walks or yoga or reading a book. Maybe it's just drinking a cup of coffee on the porch, getting some fresh air. Little things can really help manage emotions, manage stress, and even just deep breathing, 3 cleansing breaths. I know sometimes when I'm getting overwhelmed or stressed, if I just take those 3 cleansing breaths, it can make a world of difference, and it can help keep you calm and focused in the situation. And then social networks, reaching out to family, friends, and maybe even online networks for that support can be extremely helpful. So along with these tips, we have lots of great resources, and I'm going to go through them quickly so we have time for questions. But on the next slide, there is a book called Confidence to Care. It's a resource for family caregivers providing Alzheimer's disease or other dementia care at home. You can find that on Amazon.com. And if we transition to the next slide, there is an app that goes along with the book. It's called the Alzheimer's and Other Dementias Daily Companion. This is a free app you can download at your iTunes or Android store, and it puts information and tips right at your fingertips. You can search by different categories. So let's say you are having trouble with bathing one day. Open this app, type in the word bathing, and lots of tips come up on how to make bath time easier. There's also a 24/7 care line that goes along with the app. The number is in the app, and it's listed here on the slide. So if a family member is feeling overwhelmed, they can't find the tips and information that they need, in the app, then they can always call that number. And finally, on the last slide here, we have some additional resources. That helpforalzheimersfamilies.com. I mentioned that earlier. They have free family training. We also have caregiverstress.com. I talked a lot about managing the stress, managing the emotions of caregiving. That's a great resource. David Troxel has the Best Friends Approach. That's a book that he wrote, another great resource. And then if there are businesses in your community that are looking to become more Alzheimer's friendly, we talked about how isolation, the caregivers having to stay home because they don't feel like they can go out with their loved one in public because people won't understand if a symptom comes up. Businesses can actually get trained at alzheimersfriendlybusiness.com. You can get information about that there. Also, the Alzheimer's Association is a great resource. We have a wonderful partnership with them. They have a 24/7 helpline. It's listed there. And then also that Facebook page I mentioned earlier, Remember for Alzheimer's Families. And that Facebook page, again, people are sharing encouragement, support. There are stories posted there. So another great resource for those family caregivers. So I know I've thrown a lot of information your way. Again, I'm so passionate about this topic, I wanted to cram in as much information as I could. So I'll now open it up for questions. So if we have any questions, I'll be happy to answer them there. You can type them into the little message box.
All right. Fantastic. Thank you so much, LAKELYN. Yes, a lot of information to cover. If you have questions, everyone, please send them in. We will pose them to LAKELYN here. The first question, you were just mentioning, LAKELYN, but can you hit us again with the name of that Facebook page for the caregivers?
Yes, it's Remember for Alzheimer's Families. So if you go to Facebook and type that in the search, or you just search Remember for Alzheimer's Families Facebook page, that will pop up. You can like it.
All right, perfect. Okay, next question. Do you think as our lives depend more on technology, will the incidence of Alzheimer's disease increase in the future?
That is a great question. I know that technology in the Alzheimer's space has helped us provide better care over the years. I know that, in terms of symptoms such as wandering, there are newer technologies that families can implement in terms of surveillance. It's also been able to help us alert our family members and friends when a loved one has wandered. In my November webinar, I'm going to talk about Prevent Wandering, but there's preventwandering.com. It's a website where you can, if your loved one's gone missing, shoot out a message to all of your contacts letting them know to be on the lookout. So technology has advanced our ways of care, but the cause of Alzheimer's disease, they're still trying to figure that out. They know that there's plaque buildups and tangles in the brain that are causing Alzheimer's symptoms and other dementias. But in terms of technology specifically causing that, I have not seen any scientific data out there that link the two specifically. But, technology has changed so much even in this lifetime, so I'm sure that it has some effects, but I'm not sure if we know what those are quite yet. That's a really interesting question. If anyone else has information on that, they're welcome to type it in the box and we can share it.
Okay, can you also remind us the name of the app that we were just talking about? Remind us the name of that one again.
Yes, it's called Alzheimer's and Other Dementias Daily Companion. So I'm pretty sure if you just type in, if you're in the Apple store or the Android store, if you type in Daily Companion, it will pull up. But if you go to helpforalzheimersfamilies.com, there's a section on there that's about the app. And I think it even has a QR reader. So if you, one of those boxes that you can scan with your phone, it'll pull the app up in your iPhone store or Android store. But again, it's Alzheimer's and Other Dementias Daily Companion. That's the name of the app.
All right. Next question, LAKELYN. Do you have any suggestions for encouraging a caregiver who is insisting that she must do everything, but she is showing obvious signs of resentment as far as the caregiving goes?
That is a great question, and it's something that I see a lot. A lot of people feel that no one can provide care for mom or dad or my husband or my wife like I can. Helping them realize that by stepping away, by letting others help, it will help them be an even better caregiver is something that I try to communicate in the family with the family members that I work with. That respite can really help them come back and be recharged. So I would also help them try to identify those around them that could help. And it could be that they are helping in various ways that really aren't taking away the care task, but maybe it's the other things like paying bills. Maybe there's a brother or a son that can help just take care of the bill pay. Maybe there's another person that could run to the grocery store for them, or maybe the local grocery store delivers groceries. That would just take one more thing off of their plate. So you could start with little tasks like those, that if you take those off of the main caregiver's plate, it can free them up to do some of the other more hands-on care. A lot of times I notice that family caregivers are more protective of those hands-on care type of tasks, or it might be the opposite, that they like to do all of the tasks around the house, but when it comes to bathing or grooming their loved one, it makes them a little uncomfortable. So you could suggest having a professional caregiver come in to provide those tasks, or another family member. So if you can start with small things to take off their plate, hopefully over time they'll see the benefits of that, and then it'll be a better caregiver.
All right. Next question, Lakelyn. Once Alzheimer's or dementia becomes so advanced and the person needs to be institutionalized, how can the family's caregivers overcome the feelings of guilt that might result from that? Tough question.
That is a tough question. And so many people want to keep their loved ones at home. And for someone with Alzheimer's disease, a lot of times being at home is comforting. The surroundings are familiar. They're already in a routine of being at home. But as the person that asked this question mentioned, sometimes it gets to such an advanced state that they do have to be put into an institution. And when talking with those families, we need to help them realize that you're doing this with best intentions. It's not that you're doing this out of malicious intent. You're trying to get them the best care that you possibly can. And at the end of the day, that's going to be what's best for mom or dad or husband or wife. Alzheimer's disease, at those end stages, a lot of times the individual becomes immobilized. They're unable to communicate their needs. And there's a lot of great institutions, care communities that specialize in Alzheimer's and dementia. If they want to keep the loved one at home all the way up until the end, there are home care companies like Home Instead. We also specialize in Alzheimer's or dementia, so bringing people in to help supplement the care can also help too. But again, reminding those family caregivers that we have to do what's best for the individual, and in some cases, what's best is moving them into a facility or community where all they do is care for those individuals with Alzheimer's or dementia, and they're the experts. And knowing that their loved one, they've made the move for the right reasons, and they can still be involved in the care. They can go visit. They can still make that end stage meaningful, and they can still engage with the loved one. But it's going to change. I talked earlier about when you're caring for someone with Alzheimer's or dementia, the caregiver is going to have to adapt to the situation. But even if the loved one has moved away, that individual can still be involved. Great question. A hard situation.
All right. Time for another real quick one here, Lakelyn. Do you have any suggestions for a caregiver that will just not let go? Even when they place the family member in a facility, they're still there as much as possible. They have other responsibilities that are not being addressed or taken care of.
That's a great question. That's another difficult situation. When you've been caring for someone for a long time, it is hard to let go. And every situation is so unique that I think it would be hard to make some general recommendations for this specific situation. But again, trying to get the caregiver to realize that because they have moved them, they can give up some parts of the care that they were once doing, and they can use that time to allocate to other activities, other commitments, and maybe even if the loved one is in a routine at the care facility, maybe they always nap from 2 to 3. You could talk with that family caregiver and say, you know what, your loved one's just sleeping at this time. Maybe that would be a good time for you to go and run your errands or take care of those other obligations, or maybe they're consistently in bed at a certain time, and let the family caregiver know that they can go ahead and leave, that their loved one will be safe and cared for. That might be one place to start. But again, without knowing all the details, it's a little difficult to make more specific recommendations. But thank you so much for the question.
All right, well, Lakeland, we have reached the end of our hour here, and unfortunately we're out of time today, but I want to thank you for joining us today and presenting on this very important topic. Thank you so much.
Thank you, Steve. Thanks, everyone, for being here.